mean, I've been doing Invisalign now for 14 years. That's one of the massive things. It doesn't impact, therefore, you've not got last minute emergencies, it doesn't impact on holidays, it doesn't impact on childcare arrangement, it doesn't mean that you're having to take time out of work commitments and things like that as well, or school for teachers or even students alike. Okay, so essentially fixed braces versus Invisalign braces have huge difference, but I suppose the big similarity is the end goal. Brace systems as a whole, they work under the same concepts, but the way that Invisalign, certainly, I mean, the most obvious thing for patients is the way that Invisalign is obviously so superior in that respect is, as the name suggests, it is invisible, or certainly nearly invisible. But the concepts are exactly the same. The difference being is, say for instance, the fixed braces, as we all know, is the metal wire. You've got the metal brackets, which, I mean, apart from very unusual cases, tend to be on every single tooth. You've got the metal anchorage brace bands at the back. But with Invisalign, all those bits are replaced essentially by tooth-coloured attachments, not on every single tooth, certainly not even on half the teeth in a number of different cases. But the wire element is replaced by the clear aligner itself. But yeah, the end goal is basically the straight teeth. And in that instance, Invisalign for most people, given that a lot of adults but also the teenagers, it works for every way of life. Every age, it works for every single occupation. If you've got a job where you're front of house, front facing, talking to people, speaking on the phone, Zoom calls, which seem to be a bigger thing these days, obviously following the pandemic. It kind of works in that respect. But another thing that a lot of patients ask me is, is Invisalign painful? And the comparison between the two systems is massive. With the fixed brace system, the wires that are put on there, they'll tend to dig in, they'll catch, they'll cause ulceration on the inside of the cheeks and the lips, which I see very regularly on some of my teenage patients that have been treated by local orthodontists. But on top of that, you've also got the difficulty cleaning in between the teeth. You can get more likely to get inflammation around the gums, but the wires themselves tend to drag the teeth over a prolonged period of time. Therefore, they've got to obviously give a lot more pressure on the teeth to move for what could be months, 2-3 months at a time. Whereas with the Invisalign system, the aligners are designed to move your teeth between about 17 and 14 days worth of movement. And realistically, only 3 or 4 of those days is movement, and the rest of it is obviously the ligaments and the bone structure catching the teeth up. So the varying amount of discomfort from the fixed braces compared to the Invisalign braces is massively reduced with the Invisalign system. So one of the biggest, I mean, I've had fixed braces as a child, a long time ago, 20 years plus, of course, but one thing I remember specifically, apart from the pain and discomfort of the fixed brace system, is the emergencies. I'd be sat there in the middle of a class, I'm talking 12, 13 years old, and I'd be sat in the middle of a class and a bracket would ping off. And that's it, I mean, this is before mobile phones, of course, couldn't ring my mum and tell her. But anyway, as soon as I got home, she's having to ring the orthodontist, trying to get an emergency appointment after school to try and get this thing glued back on. And I specifically remember the amount of times it was happening because of my, the arrangement of my teeth. It was happening a lot. And kind of almost feeling at fault in a sense. When I'm turning up to the orthodontist, these things are pinging off. I'm a nuisance because it's pinged off and they're already busy. But genuinely, I mean, I've been doing Invisalign now for 14 years. And with all the attachments, which are essentially the replacements for the brackets, I take great pride in saying to my patients, I've lost about 5 attachments during the course of treatment that can be anywhere from 6 months right the way up to some cases, 2 years. I've lost 5 attachments. Now, if the average patient has got sort of 12 attachments roughly, and we've treated hundreds of patients over the last 14 years, I mean, you're talking 0.00%. And even then, the likelihood is, I mean, you're going to be able to get in to see me within 24 hours to get that glue back on. But that's one of the massive things. It doesn't impact, therefore, you've not got last minute emergencies, it doesn't impact on holidays, it doesn't impact on childcare arrangement, it doesn't mean that you're having to take time out of work commitments and things like that as well, or school for teachers or even students alike. I suppose again, a comparison between the two systems, your fixed brace against the Invisalign system. Okay, there's a negative. There's a negative to the Invisalign system over the fixed brace, believe it or not, and it's commitment. Fixed braces are glued in. There's no getting that thing off, okay? You're committed, it's on, particularly helpful in teenagers that might be a bit like, oh, I don't really want braces and can't really be relied upon while they're at school, mum, dad's not checking up on them. But the fact that they're fixed in and the fact that Invisalign system is removable is actually another disadvantage of the brace system, in that you get food trapped around the brace all the time. Brushing them is a nightmare. I mean, I see adults now all the time that I know that they've had fixed brace systems in the past because they have these little white marks or little brown marks around some of the teeth where they've had plaque build up as a child around the metal brackets. Whereas you switch then to the Invisalign system, the brace is removable. Now, apart from the social implications of that, where you can go out, you might have wedding photos if you're part of the bridal party or whatever, but there might be family occasions, whether it be, again, weddings, Christmas dinner, meals out, things like that as well. You can take the braces out and it doesn't impact on the treatment outcome whatsoever. So again, you flip to things like flossing, TP brushes, or the interdental bits. There's absolutely no way of doing those things effectively with a fixed brace system, whereas there is absolutely no reason whatsoever that you cannot do that with the Invisalign system, because you can take it out.